Hello everyone, I'm Shahnazia Nazir, studying at Astana Medical University. Today I'm going to prepare a video on hand hygiene treatment. So in this video, first of all, starting with what hand hygiene is. It is basically cleaning hands with soap, water, or we can use sanitizers also to remove all the dirt, grease, viruses, bacteria, microorganisms that are unwanted. And there are different levels of hand hygiene, like there is social hand hygiene, there is antiseptic hand hygiene, there is surgical hand hygiene. So these different hand hygienes have one main reason, that is main motive, that is to remove and kill the microorganisms, the unwanted bacteria, unwanted viruses from our hands. So coming to the technique, there are different techniques, there are different steps of hand hygiene that I am going to show you in this video. So let's get started. So there are different steps of hand washing, hand hygiening. Starting with the first step, that is we have to first wet our hands, make our hands wet. And here I am using a sanitizer. So first of all, we have to pour the sanitizer on our palm and rub hands palm to palm. Then the second step is that we have to rub back of the hand with the palm of other. See this. Here is the back of the palm and the back of this hand and palm of this hand, and fingers are interlaced. Then the next step is that we have to rub hands in a way like this, palm to palm with fingers interlaced. Here the fingers are interlaced. Then there is another step, that is rub with the back of the fingers to opposing palm with fingers interlocked. Here the fingers are interlocked with the back of the fingers to the opposing palm. Then the next step is we have to rub each thumb clasped in opposite hand using rotational movement, like this for both the hands. Then the next step is that we have to rub the tips of the fingers in opposite palm in circular motion. Then there is rub each wrist with opposite hands, rinse hand with water, and then we have to dry our hands, because drying is also a process. As if we let it as it is, if we will not dry our hands, then it will get recontaminated again.